Yes, my name is Peter Bach. I'm the director of the Center for Health Policy and Outcomes at Memorial Sloan Kettering Cancer Center. I'm also a physician there. I am the creator or something like that of the DrugAbacus, which is an interactive tool for exploring alternative ways of pricing drugs based on their value. The DrugAbacus, it's essentially like a math equation you can manipulate so that you can figure out alternative ways of pricing specific drugs. And the DrugAbacus is an interactive tool. It sits on the web, and it has real data about real drugs used to treat cancer inside of it. And so you can explore questions like, what would happen if I decide I want to pay a lot for drugs that have novel scientific mechanisms? What would that do to how much I'm going to spend on drugs total? Or if I don't want to change how much I spend on drugs and I want to pay a lot for drugs that have a novel mechanism, what does that do to the prices of drugs that don't? And in the DrugAbacus, you can explore what the prices are based on a value-based equation you write, essentially, compared to what they are today. Yeah, so I think we're still in the early days of analytics helping us think about either pharmaceutical pricing or real-world data or the evidence supporting drugs. And in the sense, those early days will be about, can we learn more about drugs and price them more appropriately when we observe how they work in real people in real clinical settings? Because right now we all heavily depend on data from clinical trials that lead to FDA approval and clinical trials run after that. And those trials tend to produce very optimistic pictures of drugs because patients tend to be younger than typical patients and healthier. So the benefits you see in those patients in absolute terms tend to be larger. Well, I think we have a little bit with hospitals, we still have this give and take between not being able to really measure hospital performance at a level I think that we need to. So that's part of a feedback loop we eventually need for hospitals to actually improve. So I think the hospitals are probably quite good in general at their own financial performance and those types of analytics, but to actually know what their outcomes are, how they compare to their peers, learn from one another, those are all places we very much need to get. And I think particularly in cancer where I focus, it's either early days or the days haven't started yet. So I've been in the field for 30 years, which is frightening to think about. And I think technology probably has changed the practice of medicine substantially less than most other sectors. We obviously see it cropping up everywhere, but even the technological changes we see, of course there's things on the margin. We have proton beam therapy and IMRT therapy that we didn't have when I went to medical school. We have some more sophisticated things, let's say in catheterization. So on the margins, the hyper expensive things, and obviously some of the super expensive new drugs are technological advances, but the actual practice of medicine looks quite similar to me from when I went to medical school. We don't have charts and binders, but we have basically the same chart inside a computer. We haven't fundamentally taken advantage of the potential of technology to transform the system more generally. And there's lots of excuses or reasons or good justifications for that, depending on how you look at it, including that each piece of technology we stick into a highly regulated and also kind of apprenticeship-based structure. So it is just a system that tends to replicate its own processes vastly better than change them. To say the least, it's a very difficult ship to turn. Most people will tell you in most systems there's no natural champions, or the people who are the natural champions are not really the people who can move things. But the practice of medicine and the work of medicine is always intense, pressured by time, pressured by revenue targets. Many hospitals run over capacity, ERs run over capacities, doctors' offices run behind. There's just a lot of strain, and the system makes it much harder actually to transform. And it's often analogized to trying to fix a road during rush hour. It's very difficult or implausible to do.